Okay, guys, let's talk about drugs for cough, which are called antitussives. So, in the United States, around 5% of adults are affected with chronic cough, and these are the treatments that we use to treat cough. We have 10 drugs here. So, the first one we have analgesic and NSAID that we use. The analgesics are acetaminophen, and the NSAIDs are naproxen and ibuprofen. Then we have the second drug, which are histamine H1 receptor blockers like loratadine, fexofenadine, cetirizine, chlorpheniramine, diphenhydramine. We have the third drug we use, which are mucokinetics or mucolytics. We have bromhexine, guaifenesin, acetylcysteine, carbocysteine, and broxol. The fourth drug that we use are topical or intranasal corticosteroids like triamcinolone, fluticasone, mometasone, budesonide, beclomethasone, cyclisonide, flunisolide. The fifth drug that we use are mast cell stabilizers like cromolyn sodium, nedochromyl sodium. The sixth drug that we use are alpha adrenergic agonists like phenylephrine, oxymetazoline, pseudoephedrine, and ephedrine. The seventh drug that we use are leukotriene antagonists like zafirlukas, montelukast, and 5-lipoxygenase inhibitor like zileuton. The eighth drug that we use are the opioids like codeine, dextromethorphan, folcodeine. The ninth drug that we use are dietary supplement containing trace elements and multivitamins. Well, for the 10th drug, we use honey and honey products. Bye for now.